I actually want to give a counterpoint to the issue of chemical weapons, which can be seen from the humanitarian response perspective as distracting. Because the issue of chemical weapons, while very important from an international law perspective and certainly from a mass kind of casualty perspective, accounts for what, 2% or so of the casualties that we've seen in Syria. The 115,000 deaths have really occurred because of direct attacks on civilians from conventional weapons and also the deprivation of resources. So I want to mention just two things briefly before my colleague Paul Spiegel gets on the line. The one issue is the types of medical response that are the sort of destruction or stress on the medical system, and then difficulties in access and accessing health systems and the ability to actually provide services. The first is that if you think about this kind of a conflict, the epidemiology of illness is different than, say, other refugee emergencies that we might think about. These are not Sudanese refugees, for example, crossing large spans of land. This is in urban settings and populations that have enjoyed actually an excellent health system and an excellent public health system previously. So the reason that people are dying are for traumatic reasons, for chronic health reasons. For example, their deprivation of their sort of chronic medications. They're hypertensive, they have cardiac disease. So it's a very different population than, say, our sort of concept of refugees. What that means is that the health system or the health services need to be higher level, right? They need to be tertiary care services providing surgical facilities and not only doing, war surgery, but actually taking care of women who need C-sections, for example, or people who need surgical care, or on the medical side, people who need diabetic care, things like that. So our causes of mortality are both by deprivation of resources and by the lack of being able to care for people because of direct trauma are very different than other concepts of refugees. In addition, this war is quite different in many other respects because of the extreme restrictions in access. It's very difficult to gain access. Matter of fact, MSF and several NGOs recently have made a point that they have seen weapons inspectors and chemical weapons inspectors moving freely throughout restricted areas to inspect and destroy weaponry, where humanitarians and people who are trying to get humanitarian access to provide food, water, medications, surgical services can never get that access. And it was a bit of a paradox in that the only people with access are the people addressing the very political issue of chemical weapons, where the real humanitarian needs of medical surgical care and very basic provision of services, we can't access those regions. So